Good evening, guys. I have beef for you all. So let me get set up for the show and I'll be right with you, please. Tonight we're discussing conditions that affect men and women differently. Okay, so sit back and enjoy this show that I made for y'all. Let me get centered. Okay. The article discusses a new study that challenges the common belief that screen time negatively impacts brain health in older adults. Researchers from the University of Texas conducted systematic review and meta-analysis of 136 studies involving over 411,000 adults aged 50 and older. Their findings suggest that regular engagement with digital technology, such as using smartphones, computers, or internets, may actually help preserve cognitive function and reduce the risk of dementia. Okay, this research supports the technological reserve theory, which proposes that digital tools keep users mentally stimulated and socially connected, contributing to better brain health as they age. The study found that digital technology use was associated with a 58% lower risk of cognitive impairment and 26% slower rates of cognitive decline over time. Okay, these findings contradict the digital dementia hypothesis, which suggests that prolonged screen exposure worsens brain function. While the results are promising, researchers emphasize the need for further studies to understand exactly how and why digital engagement provides these cognitive benefits. They also highlighted the importance of identifying which types of digital activities, such as gaming, social networking, or learning new software, offer the greatest advantages at different life stages. The study could shape how we think about aging and mental sharpness in the digital era. Okay, what are your thoughts on this? Do you think digital engagement should be beneficial for older adults? Cognitive connection, guys. Whatever elderly people can use to keep their minds sharp is a good thing. We as we as gerontologists, we use different cognitive brain games, different programs to gauge their brain activity for testing sometimes. Matching games, like, um, you know, different tiles have different pictures on them. So you scramble the tiles and you see if you can find the matches to those pictures. That's part of keeping cognitive decline at bay for people. And what also helps is if they read the paper. Every morning people read the paper, or if someone sits down with them and has a conversation about daily daily happenings, current events, that helps with cognitive recall, because people can make a brain game out of it. Ask them questions about what's in the paper, sort of like a trivia game, and then people can get prizes at the end of the trivia game. So that works for folks in the nursing homes. We use those in the nursing homes a lot for to measure somebody's recall. All right, so I'm going to finish this now. What are your thoughts on this? Do you think digital engagement should be beneficial for older adults? My answer is yes. Then you go down. The technological reserve theory suggests that regular engagement with digital tools such as smartphones, computers, and the internet helps maintain cognitive function and reduces the risk of dementia as people age. It proposes that using technology keeps individuals mentally stimulated and socially connected, which contributes to better brain health over time. This theory contrasts with the digital dementia hypothesis, which argues that excessive screen time may harm cognitive abilities. However, recent research indicates that digital engagement is associated with hold on, switch. 58% lower risk of cognitive impairment and 26% slower rates of cognitive decline. Essentially, the technological reserve theory views technology as a cognitive assess rather than a liability asset rather than liability, suggesting that digital tools can act as mental exercises and strengthen brain function. Do you think, does this align with your perspective on technology and aging? Okay. Then the rest of the presentation is the technological reserve theory and the digital dementia hypothesis take opposing views on the impact of digital technology on cognitive aging. Okay, technological reserve theory. This theory suggests that engaging with digital tools such as smartphones, computers, and the internet helps maintain cognitive function and reduces the risk of dementia. It argues that technology keeps individuals mentally stimulated and socially connected, contributing to better brain health over time. Studies have found digital technology use is associated with a 58% lower risk of cognitive impairment and 26% slower rates of cognitive decline. Okay, digital dementia hypothesis. This hypothesis originally popularized by neuroscientist Dr. Manfred Spitzer suggests that excessive screen time leads to cognitive decline, particularly in memory and attention and crucial thinking or critical thinking. It argues that outsourcing mental tasks to digital devices, such as relying on GPS for navigation or using smartphones for reminders, reduces brain engagement, potentially altering cognitive disorientation. Recent research challenges the digital dementia hypothesis, showing that digital engagement may actually foster cognitive resilience rather than harm brain function. The findings suggest technology can enhance problem solving, social connections, and independence, ultimately supporting cognitive health in older adults. This debate is reshaping how we think about aging in the digital era. Do you lean toward one perspective more than the other? Okay, then we go down. The technological reserve theory suggests that regular engagement with digital tools, such as smartphones, computers, and the internet, helps maintain cognitive function and reduces the risk of dementia as people age. It proposes that using technology keeps individuals mentally stimulated and socially connected, folks. Which contributes to better brain health over time. This theory contrasts with the digital dementia hypothesis, which argues that excessive screen time may harm cognitive abilities. However, recent research indicates that digital engagement is associated with a 58% lower risk of cognitive impairment and 26% slower rates of cognitive decline. Essentially, the technological reserve theory views technology as a cognitive asset rather than a liability, suggesting that digital tools can act as mental exercises and strengthen brain function. You can explore more about this concept here at msn.com, guys. What do you think? Does this align with what your perception? Does this align with your perspective on technology and aging? The technological reserve theory and the digital dementia hypothesis take opposing views on the impact of digital technology on cognitive aging. Technological reserve theory. This theory suggests that engaging with digital tools such as smartphones, computers, and the internet helps maintain cognitive function and reduces the risk of dementia. It argues that technology keeps individuals mentally stimulated and socially connected, contributing to better brain health over time. Studies have found that digital technology use is associated with a 58% lower risk of cognitive impairment and 26% slower rate of cognitive decline. Digital dementia hypothesis. The, the hypothesis, originally popularized by neuroscientist Dr. Manfield Spitzer, suggests that excessive screen time leads to cognitive decline, particularly in memory and attention and critical thinking. It argues that outsourcing mental tasks to digital devices, such as relying on GPS for navigation or using smartphones for reminders, reduces brain engagement, potentially altering cognitive deterioration. All right. Okay, recent research challenges the digital dementia hypothesis, showing that digital engagement may actually foster cognitive resilience rather than harm brain function. The findings suggest that technology can enhance problem solving, social connections, and independence, ultimately supporting cognitive health in older adults. Okay, this debate is reshaping how we think about aging in the digital era. Do you lean toward one perspective more than the other? All right. I have more for y'all. Wait 1 second, please. Okay. Okay, the article that conditions that affect men and women differently explores how various health conditions impact men and women differently due to biological, hormonal, and psychological differences. Here are some key points. Heart attacks. Women often experience different symptoms than men, such as upper back pressure, jaw pain, nausea, and dizziness, rather than the classic chest pain. Women also have higher mortality rate after a heart attack. Okay. COVID-19. Men tend to have more severe cases, possibly due to pre-existing conditions like high blood pressure, diabetes, and then women may have stronger immune systems or responses due to estrogen. Okay. Then here's another one, guys. It's MS, multiple sclerosis. While MS is more common in women, the primary progressive form, or PPMS, affects men and women equally and is harder to diagnose and treat. Okay. Stroke. Women experience additional symptoms such as fainting, agitation, and hallucinations and seizures. They also tend to have worse recovery outcomes. Sexually transmitted diseases, or STDs. Women are less likely to show symptoms but face greater complications such as chronic pelvic inflammatory disease and frailty issues. Hair loss. Men experience hair loss more frequently and in a distinct pattern, while women tend to have thinning hair or random baldness or random bald patches. Okay, then there's aches. Women are more prone to adult aches due to hormonal fluctuations, and treatments often differ based on gender. Stress. Women report stress more often and experience physical symptoms like headaches, upset stomachs, whereas men tend to have fewer physical manifestations. Urinary tract infections. Women get UTIs more frequently due to auto mechanical differences, while men's UTIs are often linked to obstructions like enlarged prostates. Okay, then you go down chronic pain. Women experience chronic pain more often than their pain tends to be more intense and longer lasting. Okay. Osteoporosis. Though more common in women, men with osteoporosis face higher mortality rates after hip fractures. The article highlights how gender differences in health conditions can affect diagnosis, treatment, and outcomes. Let me know if you'd like more details on any of these. Okay, then I've got treatments for men and women can differ due to biological, hormonal, and psychological variations. Here are some key differences. Heart disease. Women often receive different medications and interventions because their symptoms and risk factors vary from men's. For example, women may be prescribed lower doses of blood thinners due to differences in metabolism. All right. Next one, guys. Pain management. Women are more likely to be prescribed sedatives instead of painkillers. They often experience longer wait times for pain treatment in emergency rooms. Medication doses. Historically, drug trials focused on men, leading to diagnoses that may not be optimal for women. Women metabolized certain drugs differently, requiring adjusted doses. Mental health treatments. Women are more likely to be prescribed antidepressants, while men may receive different therapeutic approaches for conditions like depression and anxiety. Osteoporosis. Women are more frequently diagnosed with osteoporosis and receive treatments like hormone therapy, while men with osteoporosis often face higher mortality rates after fractures. Medical research is increasingly recognizing these differences, leading to more personalized treatment for both men and women. Let me know if you'd like more detailed on any of these. Okay, then I've got examples for y'all. So I'm going to go down through those. One example of a condition with gender specific treatment differences is osteoporosis. While the disease primarily affects women, men who develop osteoporosis often face different treatment approaches due to distinct risk factors and disease progression. Okay, osteoporosis treatment differences. Medication. Women are more frequently prescribed bisphosphonates like aldronate or resdronate due to their give me 1 second, guys. due to their established effectiveness in reducing fracture risk. Men may receive different medications such as testosterone therapy or if their osteoporosis is linked to lower testosterone levels. Hormone therapy, estrogen therapy is sometimes used for postmenopausal women to slow bone loss, but this is not an option for men. Instead, men may be evaluated for another hormone-related treatments. Screenings and diagnosis. Women are more likely to undergo routine bone density scans, whereas osteoporosis in men is often underdiagnosed and detected later, leading to differences in preventative care. Fracture risk and recovery. Men with osteoporosis experience higher mortality rates. Okay, after hip fractures, promoting more aggressive post-fracture interventions like physical therapy and lifestyle modifications. Would you like details on other conditions? I'd be happy to compare treatments for heart disease, chronic pain, or anything else. Okay, bisphosphonates are commonly prescribed for osteoporosis and other bone-related conditions, but they come with potential risks and side effects. Here are some key concerns. Gastrointestinal issues, oral. Biphosphonates can cause acid reflux, esophageal irritation, and stomach upset. Patients are often advised to remain upright for 30 to 60 minutes after taking the medication to reduce these effects. Okay. Give me 1 second. Paper. Osteoporosis in the jaw, or ONJ. Long-term use has been linked to rare condition where the jawbone deteriorates, particularly in patients undergoing dental procedures or those with cancer. Atypical fractures. Some patients on long-term biphosphonates therapy have experienced unusual fractures in the thigh bone due to suppressed bone remodeling, flu-like symptoms, intravenous biphosphonate may cause mild flu-like symptoms after the first infusion. Though these usually subside with subsequent treatments. Esophageal cancer concerns. There has been speculation about possible link between oral biphosphonates and esophageal cancer. But the FDA has not confirmed an increased risk yet. Okay, despite these risks, biphosphonates remain the effective treatment for osteoporosis, significantly reducing fracture risk if you're considering or currently taking biphosphonates. Discussing these potential side effects with your doctor can help determine the best approach for you for your bone health. Let me know if you'd like more details. Okay, biphosphonates offer several benefits, particularly for individuals with osteoporosis and other bone-related conditions. Here are some key advantages. Increased bone density. These medications help slow down bone loss and improve bone strength, reducing the risk for fracture. Folks. Okay. Fracture prevention. Biphosphonates significantly lower the likelihood of fractures, especially in the spine and hips, which are commonly sites for osteoporosis related breaks. Long-term effects. Some biphosphonates, like zoledrone acid, require frequent dosing, i.e. once a year, making them convenient for long-term management. Okay, cancer-related benefits. They are used to treat conditions like hypercalcemia of malignancy, high blood calcium due to cancer, and can help prevent bone damage in individuals with metastases cancer. Treatment for Paget's disease. Biphosphonates are effective in managing Paget's disease, a condition that leads to abdominal bone remodeling, while by bisphosphonates provide significant benefits. They also come with potential risks. So it's important to discuss them with a healthcare provider to determine the best approach for you for your bone health. Let me know if you'd like more details. Okay, folks. So that's B for you. I'll try and get back on later for another show or two. We'll see how things go tonight. See if I have time to do extra shows. For now, I'm going to take a little break and I will see if I can come back on later. Okay, folks, I'll see you later for shows. For now, Gator Wellness, take care, folks.